So what is COVID-19? Coronavirus disease, or more commonly known as COVID-19, is an infectious disease caused by the newly discovered coronavirus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. Now, let's talk about how it spreads. The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes, or exhales. These droplets are too heavy to hang in the air and quickly fall on floors or surfaces. You can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19, or by touching a contaminated surface and then your eyes, nose, or mouth. These are the following social institutions that are affected by the COVID-19. First off is family.
According to UCHealth.com, the novel coronavirus or the COVID-19 pandemic is impacting everyone, some more drastically than others. For a number of families, it could mean making big changes in everyday routines due to financial hardships. COVID-19 has a big impact on families. There's a lot of changes in the way of living. It is needed to adjust due to the lack of money because some parents turned out jobless because some companies can't afford to pay their employees. We all know that Filipino families are so engaged in gatherings. Like we are celebrating with our extended family in every achievements we got. And birthday celebration is a mess. But now, there's also a changes in that way of living. Because of the community lockdown, we can't just go anywhere. It is just needed to stay home. Nowadays, we don't have much personal communication with our family. And that's way too sad for us.
Next, we have economy.
According to Frontier.com, COVID-19 is not only a global pandemic and public health crisis, it has also severely affected the global economy and financial markets. Significant reductions in income, a rise in unemployment, and disruptions in the transportation, service, and manufacturing industries are among the consequences of the disease mitigation measures that have been implemented in many countries. Of course, it has a huge impact in our economy. Many structures like malls forced to close. Even the small businesses, the fast foods and restaurants, the clinics and other infrastructures have been forced to close. And even supermarkets only have a limiting hour of opening time. We all know that these structures contribute the most in terms of taxes, which is used as the currency for our economy. But now they can pay their taxes because their company lost sales and whether others get bankrupt. So we can see that the economy affected so much. Education.
COVID-19 has a drastic impact on the methods of learning. Now, we are doing online classes which take a huge toll on everyone's financial situation and mental stability. Students say that they are not learning anymore. Outputs are more valued, which is not easy to do by everyone, for there are also other factors that affect their capability to pass requirements, such as slow internet connection and the lack of money to provide this, or not having the proper gadgets that are suited for the not new, but mode of learning that we're not used to. On the other hand, COVID-19 opened the doors for innovation and maximization of technology. I just wish that every person from different aspect of the society can access and utilize this.
Health.
The effects of COVID-19 in health institution here in our country is so hard because even though we have many nurses here in our country, since they are exposed in the patients that have the virus, our nurse here is decreasing because they can also get the virus in the patients that they're caring for. Um, as time goes on, many hospitals in Manila is getting filled with patients. because the increasing cases of COVID-19, and they also start to use alternative health system. And for me, this is the worst effect of COVID-19 pandemic here in our country, is the people to use alternative medicine without the medical experts' consent. Although many is, is cured after they use alternative medicine, but it is not safe to use alternative health system, because for me, there's a small chance that you can get healed in traditional system, and it might get worse to use it, especially in these pandemic times.
Religion.
We know that many people across the country look forward to celebrating events like Christmas and Easter Sunday, or just a simple visit by the church every Sunday, in a communal way with family and friends, and it must be very difficult not to do so this year because of the pandemic. But this is the time when the best way to care for our families and communities is to stick to physical distancing and other prevention measures. Of course, not only the Catholic, but different religional congregations in the Philippines are aware of this and have taken steps to provide their services to the public amidst the pandemic. Services like online-based church masses, community prayers, spiritual recollections, and retreats. Also, people dealing with issues about mortality, coping and recovery are provided with online formative counseling and pastoral guidance. It may not be as impactful as to when we experience these things personally, but with the current pandemic, this may be the best solution that congregationals can provide, where can they provide their services while also keeping the people safe. Because of the pandemic, it is now more evident that religious and spiritual interventions play a crucial role in this public health crisis. Not only can it can guide people to find meaning and acceptance in the midst of suffering, but aside from these spiritual uplifting programs, the congregationals, or more specifically, the Catholic Church, has also provided personal protective equipment and face masks to health workers, initiated feeding programs to the poor, and has opened its door to the homeless.